What do you need to know about the stillbirth? Answer to common question about this tragic love of life by UNICEF. One stillbirth happens every 16 seconds. That's about 2 million babies stillborn every year. What makes this death even more tragic is that the majority could have been prevented through quality care during pregnancy and at birth. Stillbirths are happening with alarming frequency in many countries, and while some progress has been made in reducing the global stillbirth rate, gains are uneven. Beyond the devastating loss of life, the psychological and financial costs for women, families, and societies are severe and long-lasting. Below are the answers to key questions about the stillbirths. About a woman in Sierra Leone sleeps after giving birth to a stillborn baby at home after 10 hours of labor. She was brought to the hospital for emergency removal of a retained placenta. Of 8 pregnancies, she has 4 surviving children. Key facts about the stillbirth. 1. Since 200, an estimated 53 million babies have been stillborn. Stillbirth is a huge burden globally, with 1 in 72 births ending in stillbirth. Most stillbirths, above 8 in 10, occur in sub-Saharan Africa and Southern Asia. Over 14% of stillbirths occur during labor. The majority of stillbirths can be prevented through quality care during pregnancy and at birth. 2. Disruption to health service, weakened healthcare, and rising poverty levels. The COVID pandemic has likely exacerbated the inquietudes that surround stillbirth. If current trends continue and investments are not accelerated, another 16 million babies will be stillborn by the time this decade ends. What is a stillbirth? A stillbirth is defined as a baby born with no signs of life after a given threshold, usually related to the gestational age, period of time between conception and birth, or wave of the baby. As stillbirths are reported in different ways across countries, the UN stillbirth estimate in this article refer to late gestation fetal death, as deaths occurring at or after 28 weeks of gestation. The 28-week or more definition helps with international comparison of stillbirth level, but it excludes stillbirths occurring at early gestational age. Because of this and the fact that stillbirths are often underreported, the real burden of stillbirths is even higher. What are the main causes of stillbirths? Commonly reported causes of stillbirth include complications during childbirth, hemorrhage before childbirth, including placental abruption, infection and maternal condition, and pregnancy complications with fetal growth restriction as a common underlying cause. A mother's health is also linked to cause of stillbirth. An estimated 10% of worldwide stillbirths are the result of obesity, diabetes, and hypertension. Factors related to the mother, such as age, smoking, can also increase the risk of maternal disease and stillbirth. From what we do know about the cause of stillbirth it is clear that providing quality care, support, and resources that encourage healthy lifestyles and pregnancies can greatly reduce a woman's risk of stillbirth. Why do so many women have stillbirths during labor? Over 14% of stillbirths occur during labor. Common causes of stillbirths that occur during labor are hypoxia, oxygen deprivation, placental obstruction, and other delivery and labor-related complications. Many of these can be avoided if key intervention, such as assisted vaginal delivery, scheduled birth attendance, or emergency C-section, are available. Where do most stillbirths happen? In 2021, about half of all stillbirths occurred in 6 countries: India, Pakistan, Nigeria, the Democratic Republic of the Congo, Ethiopia, and Bangladesh, in order of burden highest to lowest. On average, the risk of a stillbirth is more than 7 times higher in low-income countries, 21 stillbirths per 1,000 total births, than in high-income countries, 3.0 stillbirths per 1,000 total births. The unequal burden of stillbirths across countries is also seen within countries themselves. Stillbirth rates are higher in rural areas than in urban areas, and socioeconomic status is also linked to a higher incidence of stillbirth. Ethnic minorities in high-income countries might lack access to quality healthcare. For example, Inuit population in Canada have been observed to have stillbirth rates nearly 3 times higher than the rest of Canada, and African American women in the United States have nearly twice the risk of stillbirth compared to the white woman. Why is there so much stigma around stillbirth? In some cultures, stillbirths are perceived as the mother's fault, resulting in public shaming or individual feelings of guilt or shame that prevent public mourning of their loss. The lack of opportunity to publicly grieve can cause stillbirth to be considered a non-event. Such social taboos, stigmas, and misconception often silence family or impact the recognition and grieving of stillbirths, contributing to their invisibility. That often means that bereaved parents are left with unanswered questions and unaddressed grief. What are the psychological impacts of stillbirths on mothers and families? Women and their partners who experience stillbirth have higher rates of depression, anxiety, and other psychological symptoms that may be long-lasting. For many women, losing the child and the subsequent care they receive will impact their approach to life and death, self-esteem, and even their own identity. Many women who experience a stillbirth may avoid people or social activities, socially isolating themselves and worsening depressive symptoms in the short and long term. Negative psychological effects can continue into subsequent pregnancies and following the birth of a healthy child. What needs to be done to reduce stillbirths? Improve health systems and high-quality antenatal and delivery care are critical to ending preventable stillbirths. This means access to functional health facilities with adequate medicine and equipment, electricity, running water, soap, and blankets, and the availability of round-the-clock referral systems every day of the week. Adequate numbers of competent healthcare workers are essential, including midwives in the public and private sectors, trained to national and international standards. What is UNICEF doing to reduce stillbirths? Every day, UNICEF is working around the world to make affordable, quality healthcare and relative for every mother and baby. In 2019, there were more than 27 million safe births in UNICEF-supported health facilities. UNICEF and partners are calling for a renewal committed to end preventive stillbirths by 2030, as outlined in the Every Neighbor Action Plan. We're supporting countries to develop their national plans and to prioritize budget for critical intervention like antenatal care, childbirth, attendance, and emergency obstetric care needed to reduce stillbirths.